Do you ever wonder if you could function happier, faster, more efficient, without any glitches, almost like upgrading an app on your smartphone? The answer is yes, you can. Although it's a little bit complicated, but you can leave all of that to us. Around age 40, our hormones start shifting, and we get exposed to a lot of different chemicals. So what happens is we start feeling fatigue. Our energy goes away. Some of my patients tell me, I'm fatigued, I have no energy, but sometimes I get angry and jumpy for no reason, and I have a hard time falling asleep. Well, the problem is the adrenal gland is off. You're suffering from adrenal fatigue or adrenal burnout, and your cortisol, estrogen, progesterone, epinephrine, norepinephrine are off. You're basically going through adrenal fatigue or adrenal burnout. And what happens is the extra cortisol in the body makes your sleep a little bit worse. And that sort of exacerbates the fatigue during the day, problem having focus, problem having stamina. We can't even exercise sometimes. So what we do at Body of Harmony is we look at all of your hormones. Number one, we look at your brain physiology. We look at your serotonin, GABA, norepinephrine, epinephrine, dopamine, to see how it's functioning. If there's any abnormalities, we'll support those by supplements as much as we can so that you're happier, less anxious, you're more motivated, and you have more energy. We look at your hormones, estrogen, progesterone, testosterone, cortisol, DHEA. These are all important hormones that help us function better, sleep better, exercise better. Even the fat around the belly can go away if your cortisol level is fine. We look at your digestive system. We make sure you can absorb things properly, digest them properly, and there is no parasites or virus or fungus inside your GI system. We look at your heavy metals, and if there's any abnormalities, we use heavy metal chelation to remove the heavy metals from your body. We look at your food sensitivities, your allergies, just to make sure you're not adding any inflammation to your body. And then we look at your inflammatory and autoimmune pathways, just to make sure there's no inflammation, and if there is any inflammation, we fix that for you. And we also want to make sure that we prevent you from having any autoimmune issues. We look at all your vitamins, just to make sure your body's working properly. If we find any abnormalities, we balance those out as well. The question is, how would you feel without any of these physiological glitches? Come try it for yourself. We'll show you how an upgrade of you feels.